Good day, viewers. Welcome once again to the YouTube channel of Crest Hospital. I am Dr. Edith, and here with me is our consultant neuropsychiatrist, Dr. Uchendu UI. You're welcome, sir.
It's a pleasure being here once again, viewers.
Okay, today we're going to be talking in continuation from where we stopped in the last series about how labor and delivery can predispose an unborn baby to mental health challenges later on in life. Sir, over to you, please. Can you shed more light?
Right, okay. Yeah, in our series, we have been trying to highlight issues about mental health, trying to look at the etiological causes of mental illness or illnesses. In the last episode, we were able to highlight issues in relation to pregnancies. Today, I want to look at a few points because these things are inexhaustible. Few points, what could have happened during labor and delivery that could predispose a baby, a child, to mental health challenges and some neurological sequelae. The first thing we'll look at is what we call prolonged labor. There is a period within which labor occurs, and what we talk about labor is the contraction that a woman normally experiences during when it is time for the baby to be born. Now, this varies from depending on individuals, but the normal time is usually between 20 to 24 hours. That is 20 hours to 24 hours when there is already what we call established labor, contraction, which has been established. Within this period of time, a baby is expected to have been born. What happens when there is a prolonged labor? This labor stage this first stage of process of delivery can last more than 24 hours. In some cases, 36, some 48 hours. This should not be allowed to happen. The obstetric team that's in charge of this should take notes, be able to establish when the time the labor commenced, and ensure that this is not allowed to prolong. What happens when it gets prolonged? There is usually much pressure on the head of the baby, and this pressure could lead to some microscopic changes in the cells of the brain, and this might lead later in future to certain neurological or mental health challenges. Another thing that could happen during this stage of labor is when we have what we call a premature rupture of the membrane. Premature rupture of the membrane, the amniotic sac that contains the baby, get ruptured prior to the onset of the labor contraction. And when this happens, in some cases, there might be what we call ascending infection. Infection from the vaginal, area of the woman might ascend to the cervix and probably can get to the baby. An infection will start occurring. There will be an infection prior to the delivery, and this could lead to neonatal sepsis at the time of delivery. This could also lead to jaundice. So immediately a woman comes in any facility and there is a premature rupture of the membrane, I believe that the medical team or gynecological team involved should try as much as possible give a cover with antibiotics having in mind that it's not just trying to bring this baby out alive, but to prevent some neurological changes that could occur due to this infection that might lead to a mental health challenge later in the life of this baby.
Okay, thank you very much, sir. So, okay, we can now progress to delivery. Are there things that happen during delivery of the baby that can predispose the baby to it?
Yeah, during delivery, usually we encourage what we call spontaneous vaginal delivery. And when it is not possible, cesarean section should be the second option. The time of assisted forceful delivery, I think, should be discouraged as much as possible. In such assisted forceful delivery, one is that remember that the skull of the baby, everything about the baby's head is still in the developmental stage, has not fully matured. Slight pressure might affect microscopically the brain of the cells of the neurons of the baby, and this could predispose this baby later in life towards having mental health challenges or some neurological problems. So one, let's try as much as possible avoid any assisted forceful delivery. Two, before a woman is the time for her to give birth, the size of the baby should be assessed. The pelvic potency of the baby, of the woman, should be known, so that it will not be a thing of trial and error. This trial and error in many of maternities or hospitals, even though when the baby comes out looking good, physically okay, some of these forceful maneuvers could affect the brain in such a way that this person might end up having what we call low intelligence deficiency or some other neurological problem that could predispose the baby to mental health challenges. We also want to encourage that during this delivery, by the time the baby is out of the mother's uterus, care should be taken in case of sepsis. But I think we might likely discuss more about this in our next episode to let us know what needs to be done immediately the baby is out of the mother's womb to avoid certain complications that might lead to mental health challenges or neurological sequelae.
Okay, thank you, sir. Sir, can you give us some examples of neurological disorders that can result in poor management of labor and delivery?
Yeah. One, poor management of labor and delivery could lead to what we call cerebral palsy, could lead to deficiency in intelligence that usually before we call it mental retardation. Poor management could lead to jaundice, jaundice in the baby, which could actually be just one of the etiological causes of low intelligence in a lot of children. Low intelligence, mental health challenges that could occur. Also, probably such mental health challenges might manifest later when this baby has gotten to probably adolescent age. The brain is being taxed more, and now you find out that this baby might not be able to cope with the normal stress of life and might start having some psychotic episode, either bipolar affective disorder, schizophrenia, or severe depression.
Thank you very much, sir. Wow, this was really educative. Well, there you have it, viewers. I hope you were able to gain a lot from this particular episode. Well, we'll have to stop now, and we hope you'll join us on the next series. Thank you so much for listening. Please do subscribe to our channel and share the link so that others can benefit from the knowledge that is being shared on our platform. Thank you.
Bye.